everyone. Today, we're going to tackle a procedure that's honestly one of the most important things you'll do as a phlebotomist, collecting blood cultures. Getting this right isn't just about top-notch patient care, it's a huge part of your certification exams. So let's jump right in. So why is this so critical? Well, take a look at this number, over 250,000. According to the CDC, that's how many deaths in the US are linked to sepsis every single year. 250,000 people. It really puts into perspective how high the stakes are, and a correct diagnosis often starts with your collection.
And what exactly is sepsis? It's a life-threatening medical emergency. It's when the body's response to an infection goes haywire and starts to damage its own tissues and organs. And you know what the gold standard is for diagnosing it? Yep, a blood culture. That means your role here is, well, it's absolutely crucial. You're literally the first link in a chain that can save someone's life.
Okay, so here's how we're going to break this down. First, we'll cover why blood cultures matter so much. Then we'll get into the nitty-gritty of preparing for a perfect draw, the actual collection process, and what to do post-draw. We'll also zero in on some critical errors you'll definitely see on your exams. And finally, we'll talk about the huge role you play in patient outcomes.
All right, let's get into it. A perfect blood culture draw, it really doesn't start with the needle. It starts way before that. Your prep work is everything. I mean, this is where you stop the #1 enemy of a good blood culture, contamination.
So think of these as your must-do, your non-negotiables. First, of course, positively ID your patient. Then, look at your bottles. Are they expired? Any cracks? Mark your target fill lines right on the bottle. That's your goal. And here's a huge one for your exam, so listen up. Blood cultures are always drawn first in the order of draw. Always. This is to keep that sample as sterile as possible. Last but not least, you got to clean the tops of those bottles with 70% isopropanol, and this is key, let them air dry. Don't blow on them, don't fan them with your hand, just let them be. That's how you know they're clean.
Okay, now for skin prep, this is super important. You don't just use the same thing on everyone. For most patients, anyone over 2 months old, chlorhexidine is your go-to. But for those tiny little infants under 2 months, you're going to use 70% isopropyl alcohol. But it's even more important than what you use, it's how you use it. We're talking a vigorous scrub. Create some friction for a good 30 to 60 seconds. And then, you guessed it, let it air dry completely. That contact time is what does the magic. It's what kills the germs.
And this quote right here, it says it all. If you take away just one thing from this section, make it this. The quality of your skin prep is the single biggest factor in whether or not you contaminate that culture. A contaminated culture can lead to a false positive, which is a huge deal for the patient. You can bet this concept will show up on your exam.
Okay, our site is prepped and ready to go. Now for the main event, the collection. We're going to focus on 2 things that can make or break a blood culture: how much blood you collect and the order you fill the bottles in. Both are absolutely critical. This is something that trips people up all the time, especially on exams, so let's make it super clear. For an adult, you're usually looking at 2 or 3 sets, and you need to get 8 to 10 milliliters in each bottle. But for kids, it's totally different. The volume is much, much smaller. We're talking 1 to 3 milliliters, and sometimes you only need the aerobic bottle. The bottom line is, you always have to check the specific order. All right, let's talk about volume, because this is probably the most important factor for getting a good result. Just remember this, volume is king. Underfilling a bottle isn't just a minor slip-up, it's a critical error. It can directly lead to a false negative, meaning the lab might miss the bacteria completely, even if the patient has a serious infection. That little line you marked on the bottle is not a suggestion, it's a necessity.
Now what about the order you fill the bottles, aerobic or anaerobic first? Well, it's not random. It's all about the equipment you're using. If you're using a butterfly or a syringe, there's a little bit of air trapped in the tubing or syringe hub. So you always fill the aerobic bottle, the one that needs air, first. That way, you push that little puff of air into the aerobic bottle, and you don't accidentally ruin the oxygen-free environment in the anaerobic bottle. Make sense, right?
So let's walk through it with a butterfly set. You've got your stick. Now keep the bottles upright, but below the patient's arm. This stops any of the liquid from the bottle from flowing back into the patient's vein. Then, just like we said, you pop on the aerobic bottle first, let it fill. Once it's done, switch to the anaerobic bottle. And after each one is full, give it a few gentle inversions, like 8 to 10 times. Don't shake it, just a gentle mix.
And what about with a syringe? It's pretty similar, but there's one huge safety rule you have to remember. Once you've done the draw, you'll attach a safety transfer device.
Then you push the bottle onto the device and just let it fill. The bottle has a vacuum that will pull the blood out of the syringe. Do not, and I mean never, push the plunger. If you force the blood in, you can destroy the red blood cells, kill the bacteria you're looking for, and even create a dangerous spray. Just let the vacuum do all the work.
Okay, the draw's done, the bandage is on, but you're not finished just yet. What you do next is just as important to make sure the lab gets a good sample to work with.
So, here's your post-draw checklist. We already talked about gentle mixing, so check that off. Next, labeling. This has to be done at the bedside. Never walk away with unlabeled tubes. Confirm that patient ID one more time, and your label needs all the key info: date, time, your initials, and, super important, the exact site you drew from, like left hand or right AC. Then get those bottles to the lab. And here is a rule you absolutely need to burn into your brain for your exam. Never put blood cultures in the fridge. The cold can kill the very organisms we're trying to find.
All right, let's switch into full-on exam prep mode. We're going to go over a few of the biggest, most critical errors. These are the classic pitfalls that you are almost guaranteed to see questions about. Getting these right is crucial for your test and for your patients.
Okay, scenario 1. You get an order for blood cultures, but you find out the patient has already gotten their first dose of antibiotics. What's the biggest risk here? What's going to happen to that culture?
You're looking at a high risk of a false negative result. It makes sense, right? The antibiotics are already in the patient's system, doing their job, which is to kill bacteria. So, even if the bacteria are there, they might not grow in the bottle. This is why it's so important to get those cultures drawn before the first dose of antibiotics is given.
All right, next up, let's say you did a fantastic job with the stick, but you could only get, say, 4 milliliters of blood for an adult bottle that needs at least 8. What's the consequence of underfilling that bottle? Once again, it's a false negative. Remember what we said? Volume's king. If you don't put enough blood in, the sample gets too diluted by the broth in the bottle. It's really just a numbers game. You've lowered the chances of actually capturing any bacteria that might be floating around in the blood. Okay, this one happens. You've done your perfect 30-second scrub, the site is drying beautifully, and then you reach out to feel for the vein one last time and your finger touches the clean area. Oops, what do you have to do now?
There's only one right answer here. You have to start all over again. You grab a new prep kit and you clean the site again for the full 30 to 60 seconds and let it air dry again. Even a gloved finger can transfer skin bacteria. You've broken the sterile field and there are absolutely no shortcuts. You have to re-prep.
So, as we start to wrap this up, I really want to bring it all back to the one thing that matters most: the patient. Every single rule we've talked about, every little step, it's all there for a reason, to make sure that the result is one the doctor can trust to make life or death decisions. Never lose sight of the incredible impact you have. Your skill, your attention to detail, you are the gatekeeper. You are what ensures a reliable result that can guide life-saving treatment. You're not just collecting a sample, you are playing a direct role in that patient's outcome. Thanks so much for taking the time to master this vital skill.